there's a lot of conversation, and I work mostly with women. So I want to pick your brain about what you have seen as well. But there's a lot of conversation about whether women should fast, should they not fast?
Yeah.
What's the best way to fast? I mean, did you personally have to do trial and error through that yourself? Like what was that kind of journey? Because I'll just throw this out there and then I'm gonna let you run with it. I can I don't know if you've noticed this. I do find that a lot of women it's easier for them to fast and not so much to refeed
Mm,
or to
mm,
be more caloric restrictive
mm.
than, increasing those mTOR pathways. But I would like to hear your journey, your personal journey with fasting, and if you've seen anything like that, like how it's different for women versus men.
Yeah. Oh my God. It's such a good question. The reason I call it fast like a girl is literally I want women to fast like a girl. Like you should fast according to your hormones and you should eat according to your hormones. You should exercise according to your hormones. There's so many things we should do according to our hormones that we are not doing.
Yeah.
So with fasting, I got obsessed with Dr. Osumi's work when he won the Nobel Prize in Medicine and Physiology for his idea or his concepts around autophagy, which
Mhm.
is when we remove food, the cells heal themselves and they repair themselves. I got so obsessed with that idea. And then combined with Walter Longo's research that 3 days of a water fast can reboot the whole immune system, that I just jumped in my mid-40s to fasting a lot. Like I did a lot of fasting, like 5-day water fast, one meal a day. And I started to notice that I was going into perimenopause. Like I was going into menopause. I was in perimenopause, but I was going into menopause. My cycle was off. I was spotting. My hair started falling out. I started getting a lot of anxiety. So I ran a Dutch test on myself, and I literally remember the day when I got the results and I pulled it up on the screen, and it basically showed all my sex hormones were
Mhm.
completely tanked. Like worse, they were worse than a postmenopausal woman. And so I went to, our mentor, Dr. Pompa. I think one thing that we as health practitioners have to keep in mind is that it's hard to doctor ourselves,
Yeah. Yeah.
right?
Yeah.
It's really
Yeah.
important that we get an objective opinion. So I showed him my Dutch test and he said, Mindy, you got to eat. What are you doing, girl? And I realized,
Yeah.
and he's one of the people I had learned fasting and detox from. And it was at that moment that I thought, okay, there has to be a cadence here. And I dove into understanding the sex hormones. And when for the first time, like Rebecca, I don't know if you've ever had this, but I'm like at 45 for the first time understanding my hormonal menstrual
Oh,
cycle.
yeah. Yeah. That,
What?
which is crazy. It's nuts. Yeah.
Like we have the bigger conversation here is we have a hormone
Yeah.
illiteracy problem, and it
Mhm.
starts with women. Women
Yeah.
don't know. So what I did is I started to dive into looking at what estrogen needed and when does estrogen show up and what does testosterone need and what does progesterone need. And what I discovered was that estrogen and progesterone actually need vastly different things. So estrogen needs you to keep glucose and insulin down. So anytime you go, estrogen's trying to come in, specifically the front half of your cycle, fasting's amazing. Keto is amazing. But progesterone, the back half of our cycle, we actually, because we're so brilliantly designed, we actually become more insulin resistant. And glucose needs to be higher that week before our cycle because progesterone demands it. So we need glucose high, we need cortisol low the week before our cycle in order for our uterine lining to shed. So you've got totally opposite personalities of these hormones.